Assalamu alaikum. Today's our topic is Gestalt Therapy by Frederick Perls and Laura Perls. Historical context. Gestalt therapy did not appear in a flash. The two primary founders of the approach were Frederick Perls and his wife and collaborator Laura Perls. The prehistory of Gestalt therapy begins in Germany. Some of the ancestors of Gestalt therapy are Buddhism, means self-intuition, Freud with his instinct theories, Wilhelm Reich with his emphasis on the body, Martin Buber with his passionate views on the need for human meeting, Wertheimer, Kohler, Kufka, and Levin presented their view of perception and thinking. The philosophy of phenomenology and existential, which became major foundations of the Gestalt approach. Gestalt is a German word with no exact English equivalent. It means a configuration or whole, an entity which is more than the sum of its parts. In his first book, Ego, Hunger and Aggression. The next is Theoretical Assumptions. First, Gestalt therapy is an existential and phenomenological approach, emphasizing the principles of present-centered awareness and immediate experience. Number 2, to discover how one blocks one's flow of awareness. The individual in therapy is directed to fully experience current thoughts, feelings, and body sensations. Number 3 is by assuming greater responsibility for experience, one learns to trust one's own resources and become less dependent and manipulative in relating to others. Number 4, Gestalt therapy is non-analytical and non-interpretive, encouraging patients to find their own meanings, set their own goals, and make their own choices. Number 5, Gestalt then emphasizes how people focused on helping individuals become more aware of the many aspects of their personhood. The next topic is image of the person. Gestalt therapy has a central idea that human beings are in constant development. Our life situations are always evolving and we do not exist independently from the surrounding field. Conceptualization of psychological disturbance. Psychological disturbance is conceptualized as loss of the ability to adjust creatively in particular situations. The next topic is major therapeutic techniques. First, enhancing awareness. The process of change starts with awareness. The major technique of Gestalt therapy is to focus on awareness training. Awareness is regarded as a basic key to personal experience, subjective experience, and change. All awareness techniques are based on here and now principle. Questioning what patient is experiencing now. Therapists avoid questioning why. Therapist encourages to answer clearly about his present mental state and discourages the patient to use any kind of defense mechanism. Using defense mechanism helps the patient to diminish his real feelings of sadness, fear, or anger. In contrast, the therapist encourages the patient to experience his real feelings as much as he can, because the Gestalt therapists believe that the resolution of the unpleasant feelings lies in experiencing it fully, not trying to avoid it. Real feelings should be acknowledged and expressed through number 1, training, 2, statements and questions, number 3, self dialogues and dreams.